Thank you. It's a pleasure to be with you all, and I'd like to thank the BC Network and Dr. Schnabel for this invitation. One of the most important factors I think people need to know is that there are things that you can do to lower your cancer risk. And even if you've already had cancer, it's never too late to strengthen your immune system and to be able to detoxify your body. So I want to talk a little bit first about what integrative oncology is. As Dr. Schnabel mentioned, I'm a board-certified medical oncologist and hematologist and internist. I did postdoc research at Rockefeller University on gene regulation, genes that could either lead to or turn off, in other words, prevent cancer. But I found over the years that despite all my scientific training, which is necessary, it's not sufficient. So all the science I use, it's wonderful, it's making a huge difference for men and women with cancer around the world. But it's not quite sufficient because there's still something that can be learned from any adversity in life. And cancer is one of them. So in my practice, I work with people with acupuncture. For instance, during chemotherapy, I recommend it once a week. Biofeedback, healing touch. I do a combination of work every time a patient comes in, whether it's for chemotherapy or for an office visit, with actually a machine that was invented by a Japanese engineer, Kita-san, who has a place in Tokyo called the Healing Garden. And he was an engineer at Pioneer Stereo before he left to start his own company. And I've been very interested in the role of music therapy. I wrote a book called The Healing Power of Sound about how every culture on earth has used music and chanting as part of healing. And there's a lot of science to show how music, chanting, breathing, guided imagery can literally increase the very part of the immune system that protects us against a recurrence of cancer. And this machine literally takes low-frequency sound from either instrumental music or chanting and puts it directly into the body. And you also listen with headphones at the same time. And just to give you a brief example of how powerful it is, the first time somebody has to go see a medical oncologist is probably the most stressful day of their whole life. They've got to find out what their prognosis is, what the side effects of the chemotherapy are, will they lose their hair, who's going to take care of their children if they have to go into the hospital. There's no more stressful day than that. And so I'll go through all the medical therapies, the potential side effects, review the CAT scans, a lot of work with nutrition, which we'll get to in a minute. And then I'll give them a session, teaching them guided imagery, letting them listen to some yoga chanting with this machine. And invariably, everybody opens their eyes at the end and says, Dr. Gaynor, that's the most relaxed and peaceful I've ever been in my life. So that's coming on the most stressful day of their life. They're having an experience that they're the most relaxed and peaceful that they've ever been. So it goes to show the power of this. And you can only imagine what doing that on a regular basis does for your immune system. So we also do a lot of work with nutrition. One of the things that's very important to tell you is you all probably think gene therapy is something that's going to be available in maybe 50 or 100 years. All of you are doing gene therapy every day, every time you're putting food into your body. It's affecting the nutrients, or bioactive. For good or for harm, you're doing gene therapy. And the nutrition makes a huge difference in people's energy levels, their side effects from the chemotherapy, and also in preventing future cancers. So there are two major areas that many of you haven't heard of that you should know about. One is nutritional genomics, and two is toxicogenomics. We all have the genes we're born with, but the expression of those genes changes depending on what you're putting in your body. The toxicogenomics, the same thing. All the pesticide residues, all the herbicide residues, the dioxin, the mercury, the arsenic, all those have genetic effects. And then there are things that prevent, literally on a DNA level, the ability of tumor cells to grow new blood vessels. So if tumor cells can't grow new blood vessels, they can't spread. And there are a number of nutrients that actually inhibit that process. For instance, soy, miso, tofu contains nutrients that literally shut down that formation of new blood vessels. Milk thistle contains silibrin, which affects angiogenesis. Red grapes contain resveratrol in the skin. That's not only anti-angiogenic, it literally allows cancer cells to die normal. Curcumin, otherwise known as turmeric, that's what gives curry its yellow color, shuts down cancer on numerous levels. There's quercetin found in apples, EGCG found in green and white tea, powerful anti-cancer. All these are literally gene therapies that a lot of our ancestors knew about but didn't understand the science on this level. Lycopene in tomatoes, very important against prostate cancer. The chili pepper has capsaicin, which some people use for arthritis. Vitamin D3 we'll talk more about, probably one of the most anti-breast cancer vitamins we know of. So these two mice up here is a mother and a daughter. The top mouse, the one with the yellowish coat who's fat, is known as a Goody mouse. And those mice become very fat. They have a sickly yellow coat. They become diabetic, and they develop numerous cancers over the course of their life. By feeding that mouse when she was pregnant with her offspring more B12, more folic acid, nutrients from beets called betaine, she was able to give birth to a genetically identical mouse, but the gene expression was changed. So this mouse has a very healthy coat, never becomes diabetic, never develops cancer. So again, you can see the power of what we call epigenetics. The genes are the same, the expression of those genes is different because of food. Then there are many toxins that go into fat tissue, especially breast tissue. These are just some of the pesticides, herbicides, and other environmental carcinogens that have been found in human breast milk, also found in cow's milk. Even if it's organic, very often you'll have dioxin, benzene, things like that that are just emitted from factory smokestacks. So it's very important about detoxification. All of our bodies have detoxifying enzymes. They're the enzymes that break down and get rid of all those toxins. But they need nutrients in order to work. Kathy Helzauer at Johns Hopkins looked at women with and without breast cancer and looked at the most common detoxifying enzyme called GST. Women with the lowest levels had a 4-fold increased chance of developing breast cancer than women with normal levels. So there are a lot of nutrients like garlic, like fish oil, come from cold, deep water fish, like broccoli, Brussels sprouts, that increase the level of detoxifying enzymes in the body. So I have an interest in two types of people in my practice. People that have cancer already and people who have a high risk of cancer. Maybe they have a strong family history, environmental exposure, and look what we can do to lower those risks. So a lot of the interventions that we use for treatment are also quite useful in prevention. So in broccoli, Brussels sprouts, cauliflower, and cabbage, there's a nutrient called indole 3-carbinol. All women have two types of estrogen metabolites in their body, a 16-hydroxyestrogen, a 2-hydroxyestrogen. Indole 3-carbinol and soy protein are the two nutrients in a diet that can literally shift the 16-hydroxyestrogen to the 2. Why is that important? Because the 16 hangs around in your body a long time and it induces breast cancer, whereas the 2 has a very short half-life. It leaves very quickly and it's very weak. So you can literally change the type of estrogens in your body by the food you're eating. Omega-3 fatty acids are critically important to consume regularly. I recommend an omega-6 to omega-3 ratio of about 3 to 1. Most people in America have about 20 to 1. But we know that breast cancer patients with higher levels of DHA, one of the omega-3s, have improved response rate to chemotherapy. They also have a lower incidence of having positive lymph nodes involved with the cancer. It also helps chemo accumulation in cells, and it inhibits cancer cell growth. So we know that many of the chemo drugs that we use to treat breast cancer work better when the diet includes omega-3 fatty acids. If you're not eating a lot of fish, then it's important to take a supplement. Also, the drug tamoxifen, a hormonal agent that we use to treat breast cancer, it's been shown that when you implant mice with breast cancer cells and either give them a diet high in corn oil, which is omega-6, or a diet high in fish oil, omega-3, versus placebo, the omega-3 included diet restored response in tumors that were resistant to tamoxifen. So literally, omega-3 fatty acids can reverse hormonal resistance, and there's a lot of drugs now that we're looking at that can do this as well. Turmeric or curcumin is very important. One of the biggest growth factors for cancer is called NF-kappa B, and turmeric inhibits on a genetic level the production of NF-kappa B in the body. It also is what we call pro-apoptotic. It helps cancer cells die normally. Apoptosis is what every normal cell in your body can do. It matures, it does its job, it dies, makes room for new cells. Cancer cells, the definition, they don't die, they just keep dividing. Turmeric and green tea are capable of restoring the ability to undergo apoptosis.